Hey, it's Whitney from EcoVeganGal.com. This video is going to be pretty different from anything I've done in a while. It's going to be more like a vlog style, casual. It's really based in my opinion, but I want this to be a conversation starter, so I really hope you'll watch it, comment, and get involved because I'm looking for your thoughts, and I think a lot of people watching this will be as well. So please join in this. This video is about whether or not to sign up for Obamacare, the Affordable Health Care Act, health insurance, whatever it may be. I'm personally trying to make that decision. Today is Friday, March 28th, and the deadline to sign up for the Affordable Health Care is on Monday, the 31st. However, they've done some extensions and all that, so it might not be a hard deadline, but really the purpose was that the government wanted people to sign up by March 31st in order to not be penalized for their taxes for this year. And I, for one, am falling into the category of somebody who does not have health care. In fact, if you've been following Eco Vegan Gal, you will know that I have this shirt that says, "Food is my health care." And for probably about the past 4 years or so, food has basically been my healthcare or healthy living in general. I have had very little reason to go to a doctor. My doctor's visits have mainly been for dental and for vision reasons. But as far as whole body goes, I've been to the doctor maybe, I think like almost 2 years ago. And, I haven't had any big health conditions that have really needed me to go to the doctor. There are often things that I have been able to solve just by taking natural remedies or doing a little bit of research or talking to friends or whatever it may be. So I've been one of those people that doesn't feel like I really need health insurance. So I want to explore my personal journey here and this conversation I had with my father about this because I gained a lot of insight, and then I really hope that you'll join in this conversation to talk about whether or not you have insurance, if you're going to sign up for it, what are your thoughts on insurance, how has it affected your life. So this all started, this idea started when I received an email from my dad asking if I was going to sign up for health insurance, and I thought about it, and I've seen the advertisements, I've seen the Between Two Ferns, which I thought was really cool if you haven't checked it out yet. I happen to be a fan of Obama. I'm not a very political person, but I've always really liked him, especially Michelle Obama. I think that she's made some strides for making the world a bit healthier a place. I wish that there were bigger movements there in the government, but I guess they're small steps, and I think that it's mainly up to us as citizens in the United States and anywhere in the world to move things forward. And that's why I've taken a lot of personal responsibility for myself, but also helping to educate other people about how they can get healthier. So with all that said, when this whole Obamacare thing came up, I thought, okay, affordable health care, that sounds really appealing to me, and I would probably sign up for that. When I first heard about it, I thought it was going to be free. I don't know if you guys are in the same boat. So then when I heard that it was something you'd have to pay for, I was like, okay, how cool would it be to have free health insurance? Don't other countries have that? And then the word affordable came into play. So like I said, I've seen these videos, these promotional videos, I've seen advertisements, but it's always been really confusing to me. I finally went on to the website. I live in California, and there's this website called Covered California that's linked into healthcare.gov, and it allows you to look at the different plans and things like that. And I started researching it, and I found out that, yeah, there were some affordable healthcare rates, but they weren't quite as affordable as I would like them to be. Obama, many times, but in that video with Zach Galifianakis, Between Two Ferns, he said, well, the healthcare is no more expensive than your phone bill. In my specific case, the cheapest healthcare plan that I could get was, I think, $40 more expensive a month. And when I added it up, it became really costly. So I wrote my dad. I wanted to get his opinion. I always trust my dad's opinion. He's very diplomatic. And this is what I said to him. I said, I'm very hesitant to sign up for healthcare. I used a credit card to cover medical expenses for the past couple years, spreading my payments across. And so thus I haven't felt insurance to be that important. Side note here is you can use, there's all sorts of special credit cards that you can use these days that will help you spread out your medical payments with no interest. And I've been using that for my doctor's visits whenever I've needed them, and it's been really, really helpful. And thus, the whole idea of getting insurance to save money or for things to cost less has kind of been outweighed by that. The lowest insurance plan I can get through Obamacare comes out to be about $1,500 a year, which is still 7.5 times my approximate tax penalty. Even when the penalty rises in 2015 and 2016, it will still be cheaper not to have insurance. For 2014, I would save X amount of money, which could go towards medical expenses that come up and probably won't even come close to that amount. I think that's a really important thing here. Things being affordable, for someone like myself who's super healthy, paying for insurance seems so frustrating, especially when it's not really that affordable in the grand scheme. When you start adding up all of your basic living expenses and then add up insurance on top of it, it's a huge cut into your money, right? And yeah, $1,500 might not seem that much, but I don't know, it depends where you are. For me, that's a lot of money to pay each year. So there are only two draws to Obamacare for me. A, instead of wasting money on a tax penalty, I'd be spending money for peace of mind. So, okay, the penalty, I'm basically giving the government money to apologize for not signing up for health insurance. Whereas if I bought health insurance, I would be spending it on something, aka peace of mind, that if I were to get in an accident or something like that, that I would be covered. And number two, if something major happened, the most I'd pay out of pocket is $6,300, which I guess is the maximum that through Obamacare, which isn't that much money, I guess. It's still a lot of money, but considering the chances of getting in an accident are pretty slim, that's a decent risk versus who knows how much. People go bankrupt when they have accidents without insurance. Okay, next point. I also don't know how to pick a health plan. They all seem the same to me. Since I rarely go to the doctor, I'm basically just looking at the cheapest plan, which based on my research has downsides. So as I was researching Obamacare, you find out the cheaper plans, some people buy these and then something big happens and they end up having to spend a ton of money. Whereas if they had gone with a more expensive plan, they would have been covered more and their deductibles would have been less and all of that. But that still comes back to that scarcity mentality for me. It's like, am I signing up for something in a what-if scenario, right? For me, I don't even want health insurance. So I'm basically signing up for something that I don't want, I don't feel like I need, and I might as well get the cheapest plan. Ultimately, it feels like I'd be buying insurance out of pressure from the government and out of fear of what if, which feels really illogical and unpleasant. It's a lot of money for me right now, so I feel quite conflicted. Should I just suck it up and aim to sell enough food as my healthcare shirts as an ironic means of affording insurance, or do I take a risk and save the money? So ultimately, those are the questions that I'm facing, and I would imagine that a lot of you watching are in the same boat or were in the same boat and have made a decision recently. Here's my dad's response to this. He said, if you're conflicted, so are many other people. Could you stimulate useful conversation in social media about how people are deciding and why? Has anyone found any really good resources to help with the decisions? Great question. I did some research, wasn't able to find anything that helpful. There's so many people talking about Obamacare right now that it's just so cluttered on the internet. So if you, the viewer, have found anything, I would love, love, love to read it sometime this weekend. Then my dad mentioned how much he spends for the family's health coverage for my mom, him, and my sister. And he said, even so, a couple major accidents/issues in the last 5 years have probably involved more expenses than our total premiums. In my parents' case, I've seen them go through various medical issues, accidents, and it's true. I mean, they have probably saved themselves a ton by having health insurance. And then he mentions, they're older than me, and other possible considerations. A sense of social responsibility to participate in a system that makes healthcare more accessible and affordable to lots of people who have previously been locked out. In other words, if healthy people don't participate, the system may not survive. I got on a phone call with my dad, and we ended up talking about this more in length. And I found myself feeling frustrated in more ways than I had realized, in that it seems so silly to me for me, when I'm stretching my budget to pay for insurance, I almost dropped something. When I'm stretching my budget to pay for insurance, just so I can be socially responsible to help out people who haven't normally had health insurance or who need the money or whatever. You know, you're basically putting all your money into a pot, and the people who need it take it out when they do. There's part of me that is glad that system exists, and then part of me that thinks, well, in my experience, and so many people in this country are using healthcare when they really don't need to. If only more people believed that food was their healthcare. There's a reason I haven't really had to go to the doctor in many years. There's a reason I've been healthy. I take care of myself every day. I don't need to go to a doctor to get medicine. I don't need to take prescriptions. I've been able to get off prescriptions by changing the way that I live. And it's so frustrating that the majority of people in this country do not think that way. They instead have been, for lack of better terminology, brainwashed in a way. And I was in that boat too, of thinking, oh, I have to go to the doctor every year, and oh, I'm sick, I better go to the doctor, and I better take this prescription. Not to say that Western medicine isn't helpful, and I'm not grateful for it, because it certainly helps at some point. But it comes back to that documentary, Forks Over Knives, right? And just that term alone. What we put on our fork can be so much more powerful than using a knife to cut something out of our body. We can prevent that whole cutting procedural process that so many people go through, whether it's heart disease or high cholesterol or diabetes or cancer. Not everything is preventable, but so much of it is. And it's so frustrating that I would be putting money towards other people who have gained diabetes because of their poor lifestyle, or who are overweight because of their poor lifestyle, or whatever it may be. And again, none of this is meant to judge anybody or to shame anybody, because everybody is unique. However, a lot of people choose poor living, and then they end up going to the doctor result. At least I wish that there was a way to convince more people to live better, to at least give them a chance to see the doctor less. Does that make sense? Huge frustration there for me. My dad also brought up that it's helpful to have peace of mind for friends and family, knowing that I'm covered. All right, so the less selfish part of me says, okay, yeah, I would like to give my friends and family that peace of mind. He also said, having coverage may reduce disincentives you may otherwise feel to seek care for when you need it. So I guess his point there is that if I do get sick, I might hesitate to go to the doctor because of the expenses. But if I have insurance and I get sick, I'll just go to the doctor because I know I'm covered. I guess so, but I don't know. In my experience, the average small doctor bill is going to be, maybe a few $100s, a lot cheaper than paying for health insurance for the year. And lastly, he said, any preventative care benefits. Would being on a plan make it more likely for you to have continuity with a primary care provider? Truth is, we're growing older. We should go see the doctor on a somewhat regular basis to check in on our bodies. You know, women, for example, should get their breasts examined to make sure that there's no signs of breast cancer. I think that these are certainly important, and we all have things that should be checked out. But there's so many resources. There's free clinics. There's places to get this done at a super affordable rate. It just doesn't seem to make sense for me. So it's scary though, because I do want to be protected. Who knows what could happen? As my dad said, he's been paying for health insurance for years, or house insurance for years, and nothing's happened to the house, but he still has the insurance that something might. You know, there was just that huge landslide, and then there's floods that happen, and there are all sorts of things that happen environmentally that we can't control. I could be in a car accident. I could fall down. I mean, who knows? Yes, there are plenty of things that we can think of that could lead to it. But really, to me, is that a scarcity mentality? Is that a what-if mentality? Is it being afraid of something and being pressured into it because you're afraid? Insurance is just a tricky thing. And, you know, I have car insurance, and I don't hesitate for that. I would like to have house insurance sometimes, because who knows? And I've enjoyed having health insurance in the past, but for some reason, maybe it's the pressure of the looming deadline. I don't know. There's a lot of things that have come into play here. Well, now I want to hear from you. So what have you been going through? Have you decided to sign up for healthcare? Did you get your healthcare through Obamacare? What led you to make your decision? How did you choose your plan? How has health insurance changed your life? And anything else you want to comment on? I know I've said some things that might be heavily charged here, but I think this is an important conversation to have and for us to address it as a community. If you're watching this channel, you're a person that is very aware of your health. You're someone that takes strides to do the best you can for your body at all times. And that's why I'm coming to you. That's why I'm sharing this with you here. I trust you, and I think that you guys are the best resource. And us collectively, perhaps we can really educate each other. Thank you so much for watching, and I look forward to your comments. Bye.